Okay, well, why don't we go ahead and get started? Good morning, everyone. As I said, thank you for making the time for this meeting on a Friday morning before the holidays. Really appreciate everyone's time and continued engagement with this work. Today's meeting is going to be about financing, so hopefully that hasn't scared too many people away. Before we get to that, though, so the agenda for today is I'm going to provide just a brief overview of sort of where we are in the process and where we're going. We've gotten a number of questions from folks just continuing to want to understand how the process is going to move forward. People are very eager to get to recommendations and improving the system, which is great. That is great enthusiasm to have. But we have a pretty deliberate kind of data-driven process that we're following, and so want to make sure that folks have a sense of that and how best to channel those recommendations. Then we are going to hear a presentation from HHS about how the juvenile justice system is funded, primarily the state funding that is going to the local level. We will then, the Justice Center, be sharing some financing models from other states that also have locally run juvenile justice systems. We'll be sharing a little bit of the data that we've been able to collect on how that compares to Michigan's financing system. Similar to what we've done in other meetings, raise some big picture questions for everyone about that financing structure. And then Justice Clement is going to help to react and lead some discussion for the whole group on this. Just before I jump into kind of where we are in the process, I do want to stress, I appreciate that the details of financing is not the most exciting thing in the world, but theoretically, this meeting might be the most important meeting that we have. Because in many states where we've worked, and our understanding from our conversations that this is very true in Michigan, is system financing and funding is often the stumbling block for moving any kind of significant statewide reforms forward. We've heard a number of times in our focus groups already that the inability to work out funding details was a big reason why Raise the Age legislation took a long time, that it's been a stumbling block to thinking about statewide policies and practices. And so all of the task force members really understanding at least some of the minutia of how the current system is financed and thinking through opportunities for improvement is really important, because potentially statewide changes are going to rest on any kind of revisions to that funding structure. Most particularly, as many of you know probably much better than we do, the Hadley Amendment really requires that any state change in sort of policy or practice expectations for folks at the local level requires the state to figure out how to pay for those policy changes. And so as this group thinks about trying to move in a more statewide evidence-based kind of direction, figuring out the funding mechanism to support those changes is going to be critical. So really hope everyone can be engaged and really want to encourage everyone to ask questions and be part of the discussion. Just in terms of, before we get to that formal part of the agenda, where we are in the process. We think about this process as 3 phases, and hopefully folks saw the slide that Nina sent out with the agenda that described those phases. But essentially, this first phase is kind of a level setting phase. We have some task force members that intimately understand and involved with the juvenile justice system every day, and others that maybe have more of a peripheral understanding. So we wanted to make sure in these first few months to really orient everyone to how the juvenile justice system operates, how kids flow through the system, key issues like system financing and data. But in the meantime, we are very busy doing 2 things. One is we are collecting as much data as possible, case level data, on how the system is operating. As probably no one on this call meeting will be surprised, that data collection is about as hard as we anticipated it would be. We are trying to collect data at the state level, collect data at the local level to understand and make sure task force members can understand from a data-driven perspective how kids flow through the system and what their outcomes are. We are also doing focus groups with pretty much anyone and everyone in the system. So with task force members, with judges, with prosecutors, with public defenders, with probation officers, with community-based and residential service providers, with youth, with families, education, workforce development, child welfare folks, behavioral health folks, all to get their perspective on what's working well in the system and where the challenges are. And so this first phase is kind of the level setting phase, and for us, where we're doing a lot of our assessment activities. We are now beginning to shift into the second phase of the work, which involves really two things. One is our next January meeting will be focused on data, but the February and March meetings, we will be presenting the results of all of that analysis. In February, we will be focusing on out-of-home placement, and in March, we'll be focusing on the front end of the system, including diversion, dispositional decision-making, and probation. And so those two meetings will be extensive and very data-driven. We'll be presenting all of the analysis that we've been able to do, as well as the results from all of our focus groups. Based on those discussions, we will then form working groups. Those working groups will be comprised of task force members, but also key folks outside of the task force members. Based on the discussions that we've had and the priorities that have been uplifted so far, we've identified working groups that include system financing, data, diversion, court processing, which includes dispositional decision-making and the public defense system, and out-of-home placement, which includes detention as well as longer-term placements. And there's certainly a lot built into each of those working groups, but those working groups are really designed to take all of the analysis that we've been sharing, all of the best practice information that we've been sharing and can continue to share from other states and from the research. And then over the next couple of months, which is really the third phase, work within those working groups supported and facilitated by us to come up with recommendations for statewide legislative change, administrative change, court rule change, funding change that then in the summer months will be shared with this full body for formal voting, discussion, and hopefully consensus-based recommendations that'll then hopefully get translated into concrete policy and practice change. So that's the process, really designed to be data-driven, designed to be led by the perspective and feedback from stakeholders across the state, and that the recommendations don't come from specific individuals, don't come from the Justice Center, but really come from working groups with a diverse set of perspectives and constituents within Michigan to then share that work with the task force. So hopefully that's helpful sort of grounding and level setting. I guess the only other thing I'll say is at any time, if there are recommendations that you want to share before we start getting to those formal meetings or conversations that you want to have, you can feel free to reach out to us because that's the input that we're collecting and want to make sure that it's part of the discussion. Any questions about that before we jump into system financing in terms of timeline process? That all made 100% sense. Should be the first time. Okay, great. All right, I am now going to share my screen and DHHS will be going through some slides about system financing. And I think we could probably take questions along the way, but maybe we'll definitely have formal time for Q&A and discussion at the end of the presentation. So with that, Teddy, take it away.
Sure. Good morning, everybody. I am Teddy J with the Department of Health and Human Services, and I manage the Federal Compliance Division, which runs our Title 40 programs for child welfare, and then also oversee most other child welfare funding programs. And I am joined today with also Soleil Campbell, who will be taking a little bit of the slides over at the end of the presentation. Soleil is the manager of juvenile justice programs, the PREA juvenile coordinator for the Children's Services Agency. Wendy Campo has also been instrumental in getting this information developed for today. She should be on shortly. She had a prior commitment, but she is the Bureau Director for CSA Administration. And so she oversees specifically my area, as well as a lot of other programs for MDHHS. So I'll go ahead and get started and just kind of talk through briefly what we're going to cover today. As Josh said, funding is a super exciting topic for a lot of us. It's my world every day. So thank you for coming along on the ride with us. It is incredibly complicated. So I'm trying to draw out the finer points here, so that those who don't understand some of the finer points of child welfare funding and JJ funding in Michigan, we can give you some high level information, and hopefully that will make sense. I'm happy to, if I need to clarify something or somebody wants to jump in, that's fine. But like Josh said, there's some Q&A time at the end of this slideshow. But this morning, we're going to briefly talk through the Child Care Fund, which is our main funder for juvenile justice services in Michigan, the impact and addition of the Raise the Age legislation on the Child Care Fund, a little bit sort of brief information about Michigan's Title 4E program and how it might relate to the juvenile justice program. And then Soleil is going to walk through some more information about the Juvenile Justice Division budget at MDHHS. So a little bit of history. The Child Care Fund is rooted in some older legislation, first enacted in 1955. I think Josh referenced the Headley Amendment that sort of allowed, well, not allowed, but sort of enacted that the department not provide any type of unfunded mandates to the counties, and that if there's new programming or new requirements, that the state finds ways to fund that. We see that sort of reflection in the Raise the Age legislation that was passed. And then we went through some amendments in 2015 and 18 to the handbook and kind of refined some things due to some audits and some administrative issues, and have really worked well with the partners and the stakeholders in the state of Michigan to refine the Child Care Fund rules. This year, this number varies, but for fiscal year 22, the department was appropriated approximately $280 million for the Child Care Fund. So that has fluctuated over the years. It's certainly grown a bit from prior years, but again, it's generally above $200 million every year.
Just one point of clarification on that includes child welfare and juvenile justice.
Yes,
so
it does.
We'll be providing a little data later about how much of that goes to specifically juvenile justice, which is a little bit of a challenge to untangle.
Thanks. Next slide. So currently, all 83 county courts and 8 tribal governments participate in child care funding. And so those accounts help provide the funding for services specific to their locality. And then only a portion of the CCF is committed to the MDHHS reimbursement program to fund JJ and child welfare costs and programming. And what we mean by that is there are lots of other programs and services that the courts and counties and tribes provide to juvenile justice youth that are not necessarily Child Care Fund reimbursable. So those are funded purely by the local courts or counties. But what we're talking about today is specifically what the state and local governments participate in child care funding. So a little bit of overview of what the Child Care Fund is. It is funding for both juvenile justice and child welfare placements and programs and services. The Child Care Fund has historically been the primary fund source for child welfare out-of-home care placements for youth that are not Title 4E eligible, and we'll talk about that a little bit later, but also specifically for any in-home care or out-of-home care programs for the juvenile justice population that meet Child Care Fund eligibility. So most of the programming is designed and administered by either circuit courts, county governments, tribal governments, and some programs are still administered by MDHHS local county offices. And there's been some changes over the years to how that works, and we'll talk a little bit more about that in a bit. But the main focus of the Child Care Fund is it's identified by the community. It's identified the types of services that are provided, the type of funding that is needed is identified locally by the courts or the counties or the tribes. They work together to figure out what kinds of programs and services are needed in their communities and seek to meet the Child Care Fund eligibility requirements to serve those needs. Prior to 2019, counties paid 100% of costs for both in-home care programming and out-of-home care programming for both the juvenile justice population as well as the child welfare neglect abuse population. So what was happening before we made a change, and we referred to that change as state pays first, the counties were paying for everything, and then the department would participate in the 50% cost share through an offset process. In 2019, 10/1/2019, the state took over payment for MDHHS supervised youth. So that includes the whole neglect abuse population and also any juvenile justice youth where we are supervising, we meaning the Department of Health and Human Services. So we're paying for those first and then seeking county reimbursement for 50% of those eligible costs. Everything else in the Child Care Fund is still paid for first by the counties and then reimbursed by the state. And we have an offset process where we sort of merge all those numbers together and figure out what the final total is every month and provide either a payment back to the county or the county provides payment back to the state. On top of that reimbursement, there's also an administrative rate of 10% for any incurred expenditures. So whatever is billed through the CCF by the county is then there's a 10% payment that's to cover some of the administrative costs. So that is included as well as the 50% reimbursement. And again, what the counties are traditionally billing for and the costs that they're incurring are for juvenile justice placements, so out-of-home placements for their JJ populations, and also the intensive in-home care services that we'll talk a little bit more about in a minute. Our reimbursement program is completely funded by MDHHS's general fund. So there's no federal dollars coming in, it's just purely state funds. And the entire Child Care Fund involves an annual budget process. So we'll talk a little bit more of the finer details soon. But in essence, every year we work with the counties and tribes to establish their budgets for the year and approve those budgets prior to the fiscal year.
Just before Teddy keeps going, any questions just on this slide? I think the fundamentals of the Child Care Fund are pretty important for folks to understand that, essentially the main mechanism for state to local funding is this reimbursement structure where counties essentially provide cost to the state for reimbursement, and that generally it's a 50% match or reimbursement for both out-of-home and in-home expenses. Judge Allen?
It would be helpful, Teddy, to explain the administrative rate, who pays who, that type of thing.
The 10% rate?
Right.
So the 10% rate is provided by the department back to the county based on its 10% of their gross expenditures that are billed on the county's 207 each month. So whatever the expenditures are, then we pay 10% in a separate payment that's issued on a monthly basis.
Thank you. I just thought it was important that people understand that.
Yeah, thank you.
Are there questions from folks? I mean, Teddy's going to get into a little bit more details about how this works, but just this basic structure.
Yes, this is Cami. What exactly is paid out of the Child Care Fund? What services and placement?
So we're going to get there, I think, in the next couple slides. So if you can, I'll wait to answer that question because I think the next couple slides will probably clear some of that up. I won't go through all of these, obviously, but there's quite a bit of statute and legislation over the years that has impacted the Child Care Fund, mainly the Social Welfare Act. But there's been obviously some amendments and some other pieces of legislation that have provided additional authority and changes to the Child Care Fund. And then generally there is also every year there's information and requirements in the MDHHS annual Appropriations Act. So when we go through the budget process, there is online available a CCF handbook that I think some of you who are part of this know where to find that. Josh, I don't know if we can link that at some point, but that gives a little bit more information about the laws and the administrative rules attached. And again, there's a little sort of caveat at the bottom: to the extent that the CCF handbook contradicts statute or administrative rules, that the statute or administrative rules supersede. So obviously we review the handbook internally and also with the Funding Leadership Council every year to make sure that everything is crystal clear. But this is just sort of a caveat in case there is a contradiction. So a little bit more about services that are provided and paid for out of the Child Care Fund. So hopefully this answers the last question. So for out-of-home care costs, when we're talking about out-of-home care, we're really talking about foster care placements, institutional care or residential. Some folks refer to it as, child caring institutions, residential placements. We also pay for, detention placements at court or county operated facilities, as well as youth that might be in independent living programs. So again, the Child Care Fund is funding through the county's payment first. A lot of these placement costs are for their JJ youth, but the County Child Care Fund also pays for MDHHS neglect abuse youth who are in these types of placements as well as any JJ youth that the department is supervising. A large portion of the Child Care Fund is the in-home care programs. And so those are community-based programs, usually court-run, or courts are partnering with service providers, contract providers to provide additional interventions and programming for youth that are either at risk for coming before the court or already potentially formally above or in front of the judge, in front of the court. So these are generally meant to be alternatives to out-of-home care. So youth that have reached a certain risk level, there's a petition pending, there's been some sort of referral to the court. These programs are geared to provide alternatives to placing children out of home. They also, for children who are in out-of-home care already, so they're in out-of-home placements, the goal of some of these programs is to also reduce the length of time in those out-of-home care placements and to return the youth either to a community-based placement or back to their family of origin in a more efficient time frame. Services could be provided both to the youth and or the youth's family to reach those goals. So more about in-home care eligibility, because this is where there's a lot of eligibility requirements around the in-home care programs. So the programs must incorporate current CCF rules and policies. And again, those are listed in the handbook as well as reflective in administrative rules. But the programs must be intensive. And I want to talk a little bit about what that means. Programs that are intensive, according to the definition of the Child Care Fund, have to do a few things. One, the youth has to have a primary caseworker that both meets the SCAO definition of caseworker, as well as that caseworker can have no more than 20 youth on their caseload. And it also requires face-to-face contacts with that youth weekly. So that's what we mean by intensive programming. It is meant to really provide very intensive services to youth and to sort of document and assess that youth's needs as they participate in programming. Again, to hopefully prevent any escalation to detention or an out-of-home placement or something else. There are lots of documentation requirements, in the social case file, as well as documenting, the face-to-face contacts and services that are being provided. But again, the goals of these in-home care programs, and this is kind of very important because these are the programs that are run by the Child Care Fund. And there may be various programs that are run by courts and counties that don't meet Child Care Fund eligibility and that are funded outside of the Child Care Fund. But these are specific to the ones that are eligible for Child Care Fund programming. The core rule here is around the intensive standard. But the goal really is either to prevent removal from the home, prevent escalation to a residential or detention, or to promote an early return to the home or community by giving, youth those intensive services that hopefully can provide the interventions necessary to prevent them from any escalation into out-of-home placement. So some examples of commonly funded in-home care programs in the Child Care Fund would be something like wraparound, home detention, counseling, and also intensive probation. So we see a lot of courts partnering with community providers to provide things like multi-systemic therapy, wraparound services, specific programming, either some courts run day programs at their detention facilities that are meant just for sort of drop-in programs where youth participate in programming and then go home. There's lots of options. And again, it varies from county to county, and there's a lot of creativity around the state in terms of how this programming looks. But they all sort of map back to that central goal of either preventing escalation to out-of-home placement or expediting a child and youth returning to the home. So for the youth that are served mostly in the Child Care Fund, it's likely that they are delinquent youth or at risk for having some sort of formal escalation to the court level. But usually a complaint or referral or petition is accepted by the court for them to participate in programming. And then either the court orders the youth into the program, or there's a signed agreement by the youth and the parent to participate. So that latter is often for youth that aren't necessarily have not been petitioned against yet, or maybe are not at the disposition level of the court, but are being offered some services prior to that escalation in hopes to eliminate the barrier and reduce the risk level for the youth. So these youth are often at risk for out-of-home placement because of either delinquent behavior or other issues that are happening within the family. The Child Care Fund also, with regards to in-home care, can fund programs for neglect abuse youth. And we had a lot of programs over the years that have specifically targeted MDHHS neglect abuse youth that are in foster care with those same goals of expediting an early return home or providing some type of service that can help aid in reunification, or potentially, if reunification is not the plan anymore, escalate to an expedited permanency. So there are still programs that specifically target neglect abuse youth, and those we refer to as our CPS categories 1 or 2. So that's the disposition of the Child Protective Services case, sort of the risk level that's associated. And those are often children who have actually been removed from the home through the neglect abuse side. So we don't have necessarily consistency across the state as to what those programs look like. That again is based on a local need. And there's often a partnership between the local MDHHS office and the court or the county to come up with programming that might meet a specific need for that local office. I'll give you a quick example. There's a couple courts that fund a contractor that provides some supervised parenting time as well as some parenting classes so that caseworkers aren't necessarily having to do solely the supervised visits, and there's sort of a parent coach attached to it. And those are specifically offered to MDHHS cases where we're trying to, expedite return home. So that's an example of sort of how those CCF in-home care programs can also benefit neglect abuse youth and not just the juvenile justice population. The other piece of the Child Care Fund is the basic grant. So this is a specific grant that is 100% reimbursed, and it's specifically for counties with populations of 75,000 or less. as well as offered to all tribal governments. And we just generally look at the DTMB population projections to understand which counties are eligible. It is very similar to in-home care programming. The restrictions and the rules are a little bit lighter, but generally it provides financial assistance for any programming for youth who are meeting a set of risk factors and coming under the court's jurisdiction or at risk of that. And that, again, those programs are also funded as part of the annual plan and budget that MDHHS approves.
Teddy, how much is the basic grant?
Sorry, that I should have said that it's a cap of 15,000 per year. So it's a small amount. There's a lot of counties that sort of also use it to assist in funding programs that are, in the in-home care population. So these is sort of extra funding, or they set it aside for other needs. So every year we go through a budget process with counties, and those start on May 1st. We open up budgets in the MySACWA system for preparation. So counties can begin working on those in the system as early as May 1st, prior to the beginning of that fiscal year. And there's two parts of MDHHS that are involved in the review and approval of these budgets. One is the program office, which would be my office. So we look and review all programs for eligibility to make sure that those programs, especially the in-home care programs, are meeting in-home care rules and eligibility factors. And we just make sure that the documentation and the program descriptions reflects what is eligible in the child care fund. And then the fiscal team, which is on our Bureau of Audit side, and is managed by Kelly Walters. They review all of the fiscal requirements in the budget to make sure that that those meet eligibility. And then budgets need to be submitted no later than August 15th in the MySACWA system, and then we usually have those approved all statewide by October 15th. And then on a monthly basis, there's a reimbursement process. So those requests are submitted also in the MySACWA system, and counties prepare all the documentation, including general ledgers, and we call it the DHS 207, which is the reimbursement form. And Kelly Walters unit also approves those for reimbursement on a monthly basis.
And we'll talk about this in a little bit, but I think it's important for folks to understand a little bit this reimbursement process. There may be other states out there that have a similar funding model, but based on our work, we only know of one other state that has this kind of reimbursement process. So one of the questions we're going to be asking the group to think about is, what are the costs and benefits of having this kind of reimbursement model, both substantively and administratively, both for the state as well as for counties?
I have a related question. Exactly or what budget at the county is involved? Is it the court's budget, or is it the county DHHS office? Who is paying for the services not covered by the child care fund?
The county treasurer is the funder. They often allocate that funding to the courts specifically, and that process is going to vary across each county and court relationship. Where DHHS is involved in programming, so if there's specific programs that are meant to address needs of the MDHHS neglect abuse population, then the local office county director is working directly with the court or county administrators to provide that information and to solidify the budget. The budgets are also approved by the county commissioners for every county.
So Cami, just to build on that, essentially counties, right, are on their own as a county determining how much locally they want to fund juvenile justice programming and services. And then there's also a budget that they have specifically for child care funding reimbursement that has to align with the programmatic details and eligibility requirements that Teddy described. So pretty much almost every county has its local budget for juvenile justice services, which both the level of that funding and what they use that funding for is totally at county discretion, and then a child care fund budget, which is what they're seeking reimbursement for from the state.
That's a kind of side follow-up. What are the requirements in order for the child care fund to pay for out-of-home placement? Are there any, I mean, 4E has a gazillion rules. Is there anything similar for the child care fund for the out-of-home placement?
Not really, as especially if we're talking in relation to the Title 4E rules. I mean, in essence, from DHHS's perspective, if a youth is not Title 4E eligible, then they are child care fund eligible. But that's sort of the primary fund source when we can't use federal funds. There are, I mean, obviously there needs to be a removal by the court, placing that child. For MDHHS kids, obviously the courts are giving MDHHS care and supervision. We have placement types that are eligible in the child care fund handbook, and I think I briefly talked about those, but those are sort of the core main ones. Relatives, a placement of a youth with a relative, licensed foster home, child caring institutions and residentials, and then independent living programs. So MDHHS has specific policy and rules around our kids that we supervise and what placements are available, right? We place kids in licensed foster homes, but we also started paying relatives out of the general fund a couple of years ago. And that allowed also, because we made that a policy, that allowed courts to pay relatives and have it reimbursed through the child care fund if they were placing a JJ, one of their JJ kids with a relative through the court system. They don't have to pay for them, but it allowed it as a eligibility when we made the change as well. So it's just frankly that they are under court jurisdiction and placing out of home care.
And it's a great question, Cami, and for us to continue to think about as a group. And as you'll see, other states have tried to use their financing structure to more explicitly kind of raise that question of who's going into out-of-home placement and how can funding encourage community-based approaches. So we'll be sharing that. I also just want to quickly respond to Janine asked a question in the chat about kind of data on county expenditures, state expenditures. We'll be sharing a little bit of the data that we were able to collect, but the bottom line is that there is no statewide kind of data on what counties are spending state dollars on specifically.
I have one more very quick follow-up. The last time we met, we heard from Midland County and Ottawa County about their specialized foster homes. And my memory is that both programs talked about those as being court programs and court homes. Are those paid through the foster or the child care fund, or is there separate funding that pays for those?
They are paid through the child care fund. And in fact, with Midland, we've had a couple of our dual wards. So, youth that are placed both on the JJ neglect abuse side, where we've gotten into an agreement with Midland to pay, since Midland is licensing, those homes themselves, which not a lot of courts do that. But we've been allowed to use those beds when needed for some of those youth that are both dual wards. And then we end up paying whatever the court has agreed to pay the home. So it's a little bit different, but we've worked with the local offices and the courts to ensure that we can offer that same rate if MDHHS kids are placed in homes like that. But those are child care fund eligible placement types for sure. So just quickly a little bit about oversight. Again, the monthly submissions for reimbursement are reviewed by the CCF fiscal team. So they go through general ledgers and supporting documentation to make sure that the expenditures are reimbursable. And then another office in the MDHHS Bureau of Audit also conducts site reviews. They take a yearly sample of counties and tribes and determine where they're going to go each year. But they do a much deeper dive. Absent of COVID restrictions, most of those audits have been on site, where they do dig deep into case files and additional documentation from the accounting and financing sides to make sure that all the practices are being aligned with the rules, and that counties have and courts have appropriate controls in place, or if they have relationships with contract providers, that those contracts are signed and approved. So that's sort of the audit process, and then we provide audit reports back to them based on the results of compliance. And then, if there's any concerns, then there's generally a corrective action plan that gets monitored. But one of the finer points, I think, with CCF is historically the department has done limited quality assurance on statewide programs, right? These programs were built and have been maintained by the local governments. They're very specific to their needs. We provide funding, but generally that's it. There's not a lot of, looking into both even with partnership in terms of efficiency or quality assurance around programs. And I think Josh has alluded to this a few times. We have limited data collection. We do have some data that's available to us through what gets put in the MySACWA system. But generally, I think one of the struggles, and I think a lot of our stakeholders would agree with this, is that we lack a lot of really great collaborative data. So that's kind of one of the limitations of the type of oversight right now that we provide. So just briefly, I'll talk about the change with Raise the Age that took place.
Sorry,
Oh,
Teddy. Kim has her hand up.
Oh yeah, sorry, I didn't see that.
Hi, Teddy. Thanks so much.
No problem.
So you identified that there's this goal to prevent out-of-home placement and to shorten placements through a focus on intensive programs. And I think, at least some people have raised an anecdotal concern that the focus on those intensive programs encourages counties to put people in more intensive programs because those are the ones that are reimbursed. So what's the source of that? Is that a statutory source? Is that an administrative source of that focus on intensive programs for the Child Care Fund?
It is built in the administrative rules. So it is a statutory obligation on how we fund it. So I don't know that I haven't really participated in conversations around this, specifically to that concern. And that's kind of one of the pieces I think that we can draw out of this, is that the department doesn't even necessarily know what other types of programs the courts and counties are running that aren't Child Care Fund eligible, that might be meeting a specific need that aren't intensive. So I don't know. I mean, I think that might be a conversation for those on this group from the court or county level to offer a little bit more insight. But it is based on, the language in the administrative rules as to what those programs have to look like.
Thank you.
And just to make sure, to uplift the point Kim is making, and I'm sure we'll get some of these reactions from, so I said, task force members and Justice Clement's feedback. But the Child Care Fund currently, because of its intensive requirement, and also the requirement that youth have to have a court case for their services to be funded, one of the questions that's raised is it forcing counties, if they want state funding, to provide more intensive supervision than some young people need to not be able to use state funding for pre-court diversion. And so it brings up the larger question of what should or could state funding be used for, and should there be more intentionality around the funding? And that's where this relationship between the funding structure, the funding eligibility requirements, I know we're getting in, a bunch of details here, which are easy to gloss over, but they really do, based on the conversations we have, and I think what we'll hear from task force members, funding really does shape oftentimes the policies, the practices, the population at the local level. And so for this task force role to really think about what should that funding structure look like to support the kind of policies and practices Michigan would want to see statewide.
Great question. So again, real quick, raise the age. So we had legislation passed in 2019 that extended funding to juvenile justice youth who come under court or tribal jurisdiction age 17. So Michigan, as probably most of you know, had not extended those services to youth who were 17. So we were, I think, one of the last states. I think there were only a few left that hadn't made the change yet. But what ended up happening was the legislation passed that allowed these youth to be served under the population, and that the state would be reimbursing reimbursing 100% of those costs, both through the child care fund. So whatever is already eligible through the child care fund will get reimbursed at 100% for youth who meet this definition. And then a separate fund, which we refer to as the Raise the Age grant, was created to reimburse expenditures that are incurred for costs that are not reimbursable through the child care fund. So any additional costs that are incurred by the court or county or tribe for including the youth in the population that would not be eligible for child care funding can be reimbursed at 100% using the Raise the Age grant. And again, that just started 10/1/21. So we worked really hard with a lot of our stakeholders and community members to get this off the ground. So we don't really have like a whole lot of impact yet in understanding where things have been, where resources have been allocated or what types of services are being provided, but we're hoping in the next 6 months we'll have a little bit more information on that.
And the quick point there is it shows the challenge and the work necessary to get buy-in for statewide change. And so you see, in order to get kind of Raise the Age legislation passed, the state, as Teddy mentioned, is reimbursing 100% of those costs to counties. So implications, again, for our task force about if there are statewide policy or practice changes, how are those going to get paid for? See that just before you move on, Teddy. Judge Allen, did you have a question or comment?
I just thought it would be an appropriate time to talk about the fact that child care fund does not pay for prevention services. So it's when you're talking about making a difference in recidivism or kids even entering the system at all, prevention is where it's at. And when I think about the programs that I have locally in Midland that make the biggest impact, it's prevention. So it's one of those things that, again, it's like the issue of intensive services where perhaps more attention is being spent with the youth, and that's counterproductive. Prevention is something that it pays back monetarily, financially, just it's almost a 1-to-5, 1-to-10 ratio. There have been different studies on that.
So we'll just quickly go through the Title IV program. I'll sort of add a caveat that we don't have a ton of juvenile justice funded through Title IV, and there's lots of different reasons for that. There's a lot of ways in which youth come before the court where, it's not necessarily, there's not a contrary to the welfare finding. So those specific findings and court orders that allow us to meet the Title IV requirements, which are pretty rigorous, often are not available for JJ youth. But we do have JJ youth that are participating in the 4E funding. And I think Josh's group has some data on that too. But in essence, the department is the designated Title IV agency for the federal government. And it's our main funder for reimbursement for specific eligible foster care costs through the neglect abuse side, as well as some juvenile justice. But there's a lot of complex eligibility and reimbursability requirements. So there are a lot of requirements around legal findings. Again, I mentioned the contrary to the welfare findings. There must be a finding that it's contrary to the welfare for the youth to remain in the home. And then reasonable effort findings, which are looked at and reviewed all the time to make sure that those findings are still being made, that reasonable efforts have been made to prevent removal, as well as reasonable efforts to achieve permanency. And when we say permanency, obviously we mean both reunification, guardianship, adoption, some sort of finality for that youth. There's also a financial determination in those requirements for the family of origin, and those are based on 1996 AFDC limits, which that is a common, I think, complaint and concern, right, is that the federal government has not changed those standards. And so we are still operating under the limits that were placed in 1996, and those have not been updated or looked at in terms of what family's income really looks like, definition of, what poverty is, and a family that's actually financially unstable. So that is a barrier, I think, for 4E, as well as we have a lot of requirements around placement licensing. So there's a lot of specific licensing requirements, obviously, for foster homes, as well as institutional placements. So residential placements have a lot of licensing requirements in order for them to be 4E. And for a lot of the JJ population, some of those placements are, because of level of security, kind of categorically not 4E eligible. And that has been, I think there's been some looking into that and trying to make sure that we're maximizing where we can, which institutions and residentials we can use 4E for, but that has been a barrier for the JJ population. Additionally, a few years ago, the Families First Prevention Services Act was passed, which is going to allow prevention, good segue, Judge Allen, prevention to be funded through the Title 4E program for the first time ever, which is wonderful news. And the department's working really hard to get prevention off the ground. But what it did do was also institute a lot of changes on how we place children in residential. So there are extensive requirements now that we refer to as QRTP. So residentials have to be QRTP certified. Youth have to have an assessment from an independent provider, which we are contracted with Maximus right now, to provide an assessment that says, yes, this youth should be placed in residential. They cannot safely remain in the community, or no, this youth with services or without services could safely remain in the community. And regardless of the department or the court's opinion on what is best for that youth, we have to adhere to those requirements, which means we have to have an assessment that says, yes, this youth is appropriate for that placement. If we don't have that, we aren't able to use Title 4E funding. And then on top of that, we also have to have the court's order that they've reviewed the assessment and also agreed with its findings to continue using Title 4E funding. So that changed earlier this year and has provided a lot more requirements on placing children in residential in order to maximize 4E. So we are reviewed on our 4E adherence to policy every 3 years by the federal government. The last several cycles, we've done very, very well. And I think a lot of that is because of the vast amount of changes and partnerships with courts and SCAO to really tighten up and make sure that consistently statewide, we're doing everything correctly as best we can, from the court order level to the MDHHS oversight level. So that's been pretty successful. And then just finally, when we determined that that we can't use Title 4E funds for the youth, and that is where the local fund source is used, which would be child care fund.
And we're going to present a little data on this, but just so folks understand kind of the importance of this, Title 4E is primarily a child welfare funding mechanism. I'd say many states, if not most states, don't attempt to use Title 4E funding for their juvenile justice population. And so we thought it's important for folks to understand that because Michigan seeks Title 4E federal reimbursement for its juvenile justice population, specifically juvenile justice out-of-home placements, that creates, as Teddy just described, an additional layer of assessments. It has requirements for all of the private residential facilities that kids are placed in, must abide by Title 4E requirements, which again are they're designed to increase the standards and the quality of services in those facilities, but they're also generally structured around a set of child welfare considerations and not juvenile justice considerations. So one of the reasons why I wanted to make sure that folks knew that Michigan is using Title 4E to support out-of-home placements for kids in the juvenile justice system is there's an important question there again about the costs and benefits of seeking that funding for the juvenile justice population, and whether that's a practice that Michigan wants to continue in the future. There's a broader set of questions here. I saw John kind of raised in the chat the relationship between DHHS and community and residential organizations. Title 4E and how those private facilities are funded is a source of consternation for the provider community. And so an important part of the funding discussion is also how the current funding structure does impact relationships between courts, between the state and between the provider community, and whether having a different kind of funding structure could support improved relationships.
And with that, and I'm sorry, I feel like I went a little bit over than I wanted to, but it's a lot of information. So thanks for hanging out with me. I'm going to turn it over to Sully Campbell to go through a little bit of information about the department's JJ division budget.
And just before Soleil starts, why are we also talking about the Juvenile Justice Division budget? And the reason, obviously, one is that, as you heard at the last meeting, the division is responsible for all kids placed in state custody out of home. But two, there's been a long-standing sort of question, if not concern, about the role of the division and HHS overall in terms of providing statewide kind of juvenile justice leadership and support. And so it's an important question to raise for us in the task force about what that division should look like, what should it be, its roles and operations, and is it funded to do the things that people would hope and expect it to do? Soleil?
Thanks, Josh. So our JJ division budget is set every year by an appropriation from the legislature that's done through the state budget process. Within that, there's very few areas of specific funding that are dedicated to the Division of Juvenile Justice. And any of our out-of-home placements come out of a foster care appropriation that's allocated under the larger Children's Services Agency. And so the specific line items that are in our budget that the legislature has authorized for spending areas are highlighted in the bubbles that you see, including Bay Pine, Shawano Center, our administration, which is our central office, and a county juvenile officer pass-through, which is not actually even something that our office oversees. That's actually through, I believe, Teddy's area. So what this means for us is that any need for our state facilities to change staffing ratios or to make significant changes within our staff facilities would require legislative approval. We don't have any specific allocations currently for in-home community-based services. We did have that several years ago, but that was cut from the budget. Our state facilities right now do operate at an 8-to-1 staff to youth ratio, and that is higher than the majority of our private juvenile justice residential facilities, but was changed to that rate due to the federal requirements for PREA, allowing us to make a specific request to state budget office for that change. We do also have a administration line item that you see here that covers our central office staff that provide the oversight of the programs that we discussed in the previous presentation that we did to the task force. And again, that county juvenile officers line item is just a pass through. So you'll see some of the areas that the administration covers. And so the administrative funds often go towards facility support, even though they're within the administrative line item. The numbers that you see in terms of FTEs are full-time equivalent employees. And so those are also appropriated, and those are the limits that we have for hiring. Next slide, please. So we do have one small line item for community support services. This helps to fund our reentry program that we have for the 2 state operated facilities to align with what we're doing in the private facilities to provide a couple of different levels of aftercare support to youth for 6 months. We also have a vocational rehabilitation match that we draw down. It's approximately a 3-to-1 match with the Michigan Rehabilitation Services, and they help to provide pre-employment services and secondary education counseling for youth in our state facilities prior to reentry, and they help to create a warm handoff to some of the local MRS offices and community-based services. We are looking to expand that hopefully in the next year with some of our private facilities. The line item for community support services also covers the contract we have with the University of Cincinnati to provide access to the MJAS or the Michigan Juvenile Justice Assessment, risk assessment tools and training, as well as the online system. And it also provides, this line item provides the allocation to the Regional Detention Support Services Program, which helps to serve rural counties that don't have juvenile detention facilities. It helps to serve them through the use of electronic monitoring with tether, home detention services, secure transportation, et cetera. There's no specific, yes.
Sorry, just before you go on, Justice Clement, did you have a question?
I did. Could you, on your prior slide, you lay out the amount for Bay Pines and Shawano Center. Could you explain what those are and then which youth are in there? I believe Teddy indicated earlier the funding for youth that the department supervises. That's where those youth are placed. Is that correct? And then do you have the numbers of how many youth are in those centers?
Yeah, so I think Derek may be able to tell you the specifics about what they're licensed for or how many we have right now. But Bay Pine Center and Shawano Center are two state-run facilities that he oversees, and those centers are used for both court supervised youth as well as our state supervised youth. So we also have contracts. The majority of our contracts are with private residential facilities throughout the state for secure and non-secure placement. And those are funded out of, as I said, the foster care appropriation in our larger children's services agency. But Bay Pines and Shawano Center are both secure treatment facilities. Bay Pines also has a detention, and again, court supervised youth or state supervised youth can be placed there. Derek, did you want to add anything there?
I was just going to answer the question about the census. Good morning, Justice Clement. Shawano has a capacity of 40 and generally hovers around that number. And then Bay Pine has a licensed capacity of 35, but a functional capacity of 32. 6 of those 32 are detention beds.
Okay, great. Thank you.
And Justice Clement will be able to share some data on who's in at least state custody in terms of out-of-home placement and where they're placed in terms of state facilities versus private facilities. So we will be sharing that analysis.
Great, thank you.
And the funding for our state-run facilities is all general fund state dollars. Title IV-E, again, is very specific and can't be used for many of the secure facilities. And in addition to that, for kids who are in our state training schools, kids are not eligible for Medicaid because they're considered incarcerated under Medicaid rules. So that's an important thing to know as well. I was just starting to talk a little bit about evidence-based community services. So we don't have a specific line item from the legislature that provides us with a flexible fund source to develop evidence-based services. We have to get any appropriations through our process within the Children's Services Agency and through the State Budget Office and legislature. So this is a competitive process that's done internally within our department. We have to put together what we refer to as proposals for change, and they are considered along with all of the other areas of our Children's Services Agency and within the entire Department of Health and Human Services, which is a very large department. We have submitted proposals for fiscal year 23 for consideration. Those were not moved forward in the process. We are right now within the next few months going to be looking at proposals being submitted for fiscal year 24. So planning really begins about 1.5 to 2 years in advance for any significant change requests that we might need to make to the state budget office and the legislature for our central office division. As you can see, we also have funding for the MCJJ, which is the governor appointed task force that determines how Title II funds are utilized in the state of Michigan. And in order to receive those funds, we have to comply with the Juvenile Justice Delinquency Prevention Act. and the 4 core requirements that we monitor for in Michigan. We are currently likely to be out of compliance in the area of the deinstitutionalization of status offenders due to some of the changes that have taken effect. And so that does put some of those Title II dollars at risk and puts the programming that's funded by those dollars to provide kids with services, working on decreasing racial and ethnic disparities and other programming at risk. We do also receive a small amount of funding for interstate compact services, and that helps to support transportation services and other things for youth that come into Michigan or who are placed out of state. And that's due to either abuse, neglect, or juvenile justice. So just a little bit about the central administrative positions that are allocated to us within the budget. We have one director, that is Derek McCree, and he also oversees the residential collaboration and technical assistance unit. And we have a secretary and a financial analyst that helps with our spending plans. We have one specialist who provides coordination and support to the MCJJ, the JJ Task Force, and the RCTAU, Melinda Fandel, you may know. We have a school principal for both that serves both our Bay Pine Center and Shawano Center and oversees the educational programming there. We also have a manager who oversees staff who work in interstate services for JJ and abuse, neglect, and the Regional Detention Support Services program. And then I have 8 staff who perform multiple roles within our division. Most of our folks hold multiple roles within our central administration due to the fact that the number of positions or FTEs that are allowed or funded for us are limited by the budget. And so as new responsibilities come forth, those are assigned within the staff that were allocated. So we have 2 analysts that do statewide placement for youth under the care and supervision of MDHHS through the Juvenile Justice Assignment Unit. We have 2 analysts who monitor and do the auditing for our facilities for the Prison Rape Elimination Act compliance, which we are in compliance with in the state of Michigan. We have an analyst who works on contract oversight for our juvenile competency evaluator trainings, our MJAS system and trainings, and our PREA contracts for federal audits. We also have an analyst who works on residential contract monitoring and serves as our liaison to our statewide child welfare information system, which is our data system. And then we have a new analyst who is working on quality assurance data and developing that for our residential contracts and state facilities. And then finally, one analyst who oversees our reentry services, working with MRS and Michigan Public Health Institute, and our community-based services, which includes youth advocate programs that is funded out of the Mental Health Diversion Council. And go ahead.
Just to add, I mean, this is obviously a lot of detail, but thought it was important for Soleil to share this because it again raises the question about how juvenile justice is funded in Michigan. And I think it's that we can share based on our work in other states. This is a very, I think to put it modestly, lean staffing structure for a statewide juvenile justice agency. Some of the responsibilities of oversight, particularly of the private residential facilities, don't just lie with the division, they lie with broader HHS. But just as a point of comparison, kind of at the other extreme, we're working with Florida Department of Juvenile Justice right now. They have 50 dedicated quality assurance officers that do quality assurance for all of the private residential facilities across the state. They have a team of 6 to 8 research staff that only work on juvenile justice data analysis and original research. Now, that is probably the other extreme compared to states where we work. But when you see funding and one staff member for all residential contract monitoring for statewide reentry and community-based services, one position for quality assurance continues to raise the question, how is funding being used? what should the role of state agency be, especially if we want to move towards more statewide policies and practices, and is the funding structure kind of sufficient to support those goals and roles? No, that's a lot of information, and I appreciated the questions folks asked along the way. Are there additional questions? Complicated funding structure, but some clear key takeaways from the Child Care Fund about the reimbursement nature of the Child Care Fund, of what it pays for and what it doesn't pay for, of the administrative responsibilities involved, of the basic grant and how basic that is, and to what extent that supports sufficient programming and services, of Title IV-E, and how that's being applied to the juvenile justice versus the child welfare population, of the lesson from Raise the Age and what's required there in terms of state funding for that kind of statewide change. So a lot of detailed information, but hopefully some big picture takeaways. Questions? Comments about just how this funding works? It made 100% sense to everyone. It took us about 3 months to understand this. So go ahead, Reverend.
Josh, I just have a comment. I think that it might be helpful, and I know it was for me on a personal level when I sat on the Criminal Justice Policy Commission when we were going through Raise the Age. I sat down with my juvenile detention center administrator and had him basically show me and walk through the process of the paperwork that they had to submit from the county to the state for the different for the reimbursement, because to me it seemed like there were some things on there that were silly that they couldn't get reimbursed for when we require them to do certain things. Because I do come from the county, obviously I'm at the state now, but I think maybe just kind of a demo of the paperwork itself that they have to fill out and what expenses are included on there, along with maybe just sending out the link to the handbook of expenses that are accepted.
Okay.
Because some people don't get all that not everything that gets billed or even everything that costs the county money doesn't necessarily get reimbursed for.
Yeah. So we'll definitely send out the link to the handbook, and I imagine Justice Clement and other folks will also have some reactions to the administrative process involved. And that is, one of the reasons why we bring up, and Teddy just put the link to the handbook in the chat, the issue of this reimbursement structure and the time and paperwork and staffing involved at the local level and also at the state level. Any other initial questions for now? Okay. I'm going to share my screen again. I'm going to go through this pretty quickly because I want us to get more to discussion. But want to do two things. One is just share some other state financing models. Going to share two states, both of which have similar structured juvenile justice systems to Michigan. Not saying these are the right models, but they are very different funding models than Michigan has. And so just food for thought for all of you as we think about potential change. Share the little bit of data that we've been able to collect on how funding is used in Michigan, and then some of those big picture questions for Justice Clement and others to begin to react to. So I'm going to move through this relatively quickly. So examples of what funding structures look like in other states that have local systems. So Ohio, for example, is a locally run juvenile justice system, 88 counties. Like Michigan, counties provide most juvenile justice supervision and services with youth in state custody placed with the Department of Youth Services. So what is the funding structure there from the state to the local level? Well, the state provides approximately $45 to $50 million annually to local courts. And that those resources are primarily support diversion from out-of-home placement and the use of evidence-based programs. So there's a couple, basically 4 different components of that funding structure. Counties receive a basic grant, a minimum of $50,000, and then additional resources basically allocated on a per capita basis to counties based on their population. So there's kind of a baseline level of unrestricted funding that all counties get. And then there's a couple of specific funding programs and block grant initiatives. So Reclaim Ohio is a funding program where the state funds courts essentially based on a formula that includes a 4-year average of felony adjudications. So it's looking at kids who are adjudicated of serious offenses and to provide funding specifically to support that higher risk population. But with a funding incentive formula built in so that essentially counties get more funding if they keep kids in the community, those more serious kids, and they get less funding for the number of bed days used in DYS placements. So essentially kids that are getting sent to secure facilities kind of counts against you in the funding formula, while those more higher risk kids that are being kept in the community, counties receive more funding. But there is an exception so that the kids who are committing the most kind of serious violent offenses, those placements are not held against counties. But it's essentially an incentive-based formula that is supporting counties to keep more kids in the community rather than send them to out-of-home placement. In addition to that, which applies to every county, Ohio has a targeted reclaim funding structure, which provides $6.5 million to the most populous counties in the state, specifically for evidence-based programs. Those evidence-based programs must be used for youth who commit felony offenses and who otherwise would be committed to state custody. And in return for that funding, counties have to use a statewide risk assessment system, which includes diversion, detention, and disposition and out-of-home placement assessments, has to engage in regular quality assurance activities, and has to collect and report data to the state on the use of those dollars. In addition to that, there is also, and those are all block grants, there is a competitive grant program called Competitive Reclaim, where courts across the state can apply to the state for funding, again, specifically for evidence-based or promising practices to divert youth from out-of-home placement with the same kind of evidence-based practice requirements along with those grants. So you can see kind of a very purposeful, strategic funding structure specifically around keeping kids in the community, around use of evidence-based programs and practices, and focused on having counties in return for those dollars to implement a set of evidence-based programs. One other quick note about that, which is Ohio partners with a number of local universities to support the quality assurance and evaluation of these grant programs, and really for statewide quality assurance and technical assistance monitoring. And as a result of this funding structure, what Ohio found was kids who are higher risk, who are served through these grant programs through evidence-based practices, have an approximately 37% recidivism rate compared to the similar youth who were committed to DYS, who have almost a 60% recidivism rate. So that's Ohio. Washington, another state with a primarily local run juvenile justice system. 33 counties with juvenile courts operate the majority of the system. And again, youth placed in state custody are with a state agency called Juvenile Rehabilitation. So in Washington, the state appropriates approximately $38 million to local courts every 2-year budget cycle. again, specifically designed to reduce reliance on out-of-home placement and to implement evidence-based programs. That's done through a block grant structure. So every county across the state gets a block grant. There's a formula built into that block grant, which includes incentivizing counties to use evidence-based programs. About 30% of the formula is based on the use of evidence-based programs. The formula is also incentivizing counties to serve higher risk youth specifically in those evidence-based programs, which research shows is more effective. And also for counties to serve a higher risk court population overall. So it's incentivizing not just evidence-based programs, not just the targeting of those evidence-based programs, but incentivizing diverting lower risk kids out of the court system overall and targeting court interventions for that higher risk population. Washington has a unique partnership with a nonprofit kind of research and evaluation institution called the Washington State Institute for Public Policy, which has helped conduct research and evaluation specifically on evidence-based programming and cost-benefit analysis, and helps to identify the evidence-based programs that are then supported through this incentive-based funding formula. The way that the funding is managed is really a partnership between the state agency and the Washington Association of Juvenile Court Administrators. The state agency does a lot of the fiscal kind of billing and oversight of the dollars. But again, sort of really importantly, in support of using these block grants, the association developed a statewide risk assessment that all counties are required to use, as well as a kind of case management process to guide counties in the use of that risk assessment. There's a statewide quality assurance committee that oversees how those dollars are used across the counties. There's a statewide quality assurance staff and certified trainers that support counties and do evidence-based program fidelity monitoring across the state. And each county is required to develop its own quality assurance plan about how to ensure those evidence-based programs are implemented effectively. And also every juvenile court probation officer across the state has to attend a 40-hour case management assessment training as part of the block grant requirements, and has to be certified every 3 years. So you can see very different funding structure and set of incentives and set of state-based kind of capacity focused on how funding is used to keep kids in the community. So what do we know about how Michigan uses its dollars? The bottom line answer to that is not much. We spent a lot of time and burdening the DHHS staff, and appreciate Teddy and everyone's patience to try to get data so we could say more specifically how is juvenile justice funding in Michigan being used. And the bottom line is until recently, there is no data to answer that question. Child welfare data and juvenile justice financing data have been merged. Historically, there isn't specific data on what kinds of programs or interventions the Child Care Fund in particular is being used for. So it's hard to say to what extent funding is being used in Michigan for evidence-based programs and practices. The one data point that we can share, and this is from fiscal year 21, is that the state reimbursed counties through the Child Care Fund for approximately $106 million. So, it's always hard to say, is that a lot? Is that a little? But, we just went through Ohio and Washington, 2 large states, and these resources are significantly more than what the state allocates in those counties. And in terms of how those dollars are used, about an even split. So about 52%, 55 million were used for out-of-home placement, 48 were used for in-home placement. There's a lot of caveats about this data. And so I would take it with a grain of salt. If my research staff were here, they'd be giving a long list. The one that I really want to point out is, our preference would never be to present fiscal year 21 data, because as you can imagine, the last 15, 20 months have been very different than the past in terms of the juvenile justice system. There have been fewer referrals and a lot fewer kids being placed out of home than historically. We talked a little bit last meeting. There's also been some closures of secure facilities that have also decreased the use of out-of-home placement. So I would venture to say, if I was speculating, that normally the proportion of dollars that are used for the child care fund for out-of-home placement is typically much higher than this 52%. But again, I don't have data on that. But raises the question, is this how Michigan wants state dollars to be used? Is it okay for the majority of dollars to be used for out-of-home placements? Or thinking again about those other state examples, are there opportunities to think about how dollars could be used in an incentive way or another kind of way to support more in-home programming, more diversion from out-of-home placement, more diversion from the system overall? And you can see that it varies dramatically across counties. So this essentially shows the proportion of child care fund dollars used by every county for in-home versus out-of-home placements. So those at the top are using dollars proportionally a lot more for out-of-home placement. And you can see it's a mix. You have some counties that use very little state dollars for out-of-home placement. And then obviously counties towards the top that are using 60, 70, 80, 90% of dollars for out-of-home placement. Maybe that kind of variation is okay. Or maybe this is something that the task force wants to consider, whether dollars should be funneled in a kind of more strategic and purposeful way. Talked a little bit about Title IV-E and kind of raised the question about whether that is a funding source that Michigan should be seeking for juvenile justice youth. There is a lot of time and administrative requirements for the state and processes that kids and families and courts have to jump through to use, and providers to use Title IV-E funding. And what you can see from this data is it's not a small amount of money, but it's not a lot. So for example, in 2020, the blue bars are juvenile justice youth, the dark green bars, I'm slightly colorblind, are for dual ward youth, talking around 150 in the past, 200 kids a year who are Title IV-E eligible that are either JJ or dual ward, and about 3 million, 4 million a year. Again, it's not a small amount of money, but just compared, for example, to the child care fund where it's $110 million a year, it's a small amount of money that the state is able to obtain in terms of federal reimbursement for juvenile justice involved youth. So it raises the question of whether that's worth the time, effort, and changes that are required accordingly.
Can I ask a quick question? For the children who are dual wards, do we have any data for the ones that are 4E eligible, how often that 4E funding was actually accessed? If that makes sense. I mean, this is about eligibility, but
no, I'm sorry. This is money that was actually drawn down.
Okay.
Yeah. So it's not just who was eligible, which is a different question, but this is actual money that the state was able to get for federal reimbursement. Do we have any idea for the dual wards then how many would be actually 4E eligible? Primarily on the parents' finance side? I don't know, Teddy, if you want to comment on that.
Do you mean, so, I mean, obviously we're looking at youth that we actually claimed for, but the other dual wards that are not 4E eligible, so sort of the proportion? Well, yeah, I'm just wondering to what extent would 4E eligible or 4E funding be available? If I guess more of the out-of-home placement of services was pushed into the child welfare system rather than the delinquency system, is there an opportunity to be using federal dollars instead of state dollars? I mean, to what extent for the dual wards, I mean, are we actually accessing the 4E funding? We can probably look at, I mean, there's obviously probably more data that we could pick through. I think, if I'm understanding your question, a lot of our dual awards, are eligible through the neglect abuse side too. So, because the originating orders are generally, meeting those criteria. And then obviously, whether it's coming through the JJ side only or both court files, we're looking at the family's finances to make the determination at the beginning. And then after that, it's just a matter of where they're placed, right? So there's obviously placements that are FORI eligible, that we can claim for, and then types of placements that are not, right? So if we place for instance, if we place a youth with a relative, we can't use federal funds right now if the relative is not licensed. But if we seek to get the relative licensed, then we can draw FORI down. And then some types of residential placements that are based on their security level, we are not able to use FORI funds. So the youth could be eligible, but then the nature of their placement doesn't allow us to claim, because the placement doesn't meet the criteria. So I think there's an opportunity to get more information on sort of, especially the dual award population. And I don't know, if it would be helpful to look at that on a more granular level where you're looking at, what came first, which file came first, where they're placed, and then over time too, how often did those placements change and when we can use FORI and when we can't. There's probably a lot more information that I think would be helpful. I don't know if I'm answering your question, so I'm sorry, but it's just a little bit more, I guess.
Yeah, and I think it brings up a broader question around, we will, I think, be able to share data with folks on dual awards generally. It does seem like there's a significant population of kids that are involved in both the juvenile justice and the child welfare system, and thinking about how to best support that population and what resources are available is something I think for this group to discuss. Judge Allen?
I just thought I would point out that the models from Ohio and from Washington have incentives for reduction on residential placements. My residential placement bill 20 years ago was over $1 million a year. It is now at 30,000 to 40,000, depending on if I even have one kid in residential placement. And I received no plowback into programming as a result of that savings. So when we look at other states, I think it is important to really view the development of local programming as a way of making sure that kids are not in residential placement, because it's shown that it's more effective. But what incentivizes the courts, the counties, to reduce that residential placement, other than it's the right thing to do? So, I mean, it is the right thing to do, and I don't have any doubt about that. But those are two very stark contrasts from Michigan.
Yeah. So that's a perfect segue. And if hopefully folks made it through the details to these big picture questions for the task force to tackle. So I'm going to go through these and then ask Justice Clement to begin some of the reactions and discussion. So the first is a broader question around what responsibility does the state have, should the state have, to pay for local juvenile justice programs and services, and not necessarily to take that responsibility for granted, but to understand what's the goal of funding folks at the local level. I think Judge Allen's comments are partly getting at that. And then in return for those dollars, what, if any, policies, programs, quality assurance, or data collection practices should locals have to adopt for those dollars? Does this current financing structure that we've gone through today, does it promote the use of statewide policies, programs, practices that research shows works to improve public safety and youth outcomes? Does it support diversion from system involvement? Does it support or incentivize use of community-based versus out-of-home placements and the use of evidence-based or promising programs? Does the current funding structure promote an equitable approach to juvenile justice across geographic boundaries, demographic groups? Saw that kind of slide that has very different practices in terms of how the child care fund is being used in terms of at least out of home and in-home placement. Are there opportunities to think about how financing can promote system equity in a variety of ways across the state, while also making sure locales have that discretion authority to their own population and their own system challenges? Brought up a couple times, so I think it's an important question. The reimbursement nature of the funding structure as opposed to a kind of block grant or another kind of funding structure. What kind of dynamic does that set up between the state and counties? Rep. Leitner was talking a little bit about this in terms of the paperwork required, the submission process, the back and forth. Does it create some inherent tension between states and the counties? What kind of administrative burden does that reimbursement structure place on both state and locales? What might a different funding structure look like that could incentivize and support more evidence-based, not just programs, but practices statewide? Should the state be looking at an entirely different kind of funding model, or are changes and improvements just needed, particularly to how the Child Care Fund currently operates? Regardless of whether it's the current reimbursement structure or a block grant or other kind of approach, should there be more quality assurance around how funding is used? Heard from both Ohio and Washington, there is intensive kind of state-led university or expert national state organization supported technical assistance to folks at the local level on evidence-based programs, on quality assurance, on data collection. Michigan has very limited infrastructure in that regard. Should that be bolstered in some way? We've been able to share very limited data. As Teddy described, there is very limited data on how do you know that the over $100 million that's being spent on the Child Care Fund is actually having an impact on recidivism, on other youth outcomes, on keeping youth and families from coming into contact with the juvenile justice and other systems. So what kind of data improvements and oversight and accountability mechanisms are needed to be able to ensure that those dollars are used effectively? Title IV funding, should the state continue to seek it? What kind of impact does that have on residential providers, on courts? And is there a way to ensure that the funding structure supports both, yes, the overlap between child welfare and juvenile justice, but ensuring that juvenile justice programs, services, residential supports, assessments are really tailored to specific needs and risks of the juvenile justice population? Related to that, what level of funding is needed for state facilities and for private facilities to effectively serve the complex needs of high risk? We talked in the last meeting about how most of those residential services are not competitively procured. Would not just a different funding structure, but a different kind of procurement structure, could that support better outcomes? Talked about the Juvenile Justice Division and what is the vision for the role that they play in terms of statewide improvement, quality assurance, and capacity. Do they have the funding? Do they have the staff needed, not just for the youth committed to their care, but to play that kind of larger statewide role? And so some of the questions that have been asked already today, what opportunities might exist to look at other federal and state funding streams, to look at behavioral health funding, to look at Medicaid funding, workforce development funding, education funding, and to better leverage that funding for potentially preventative purposes or to better wrap services around kids in the juvenile justice system. So a lot of big picture questions. I'm not going to ask Justice Clement to answer all of them, but would love to hear some of your feedback and reactions and the reactions from the courts that you've been speaking with.
Thank you, Josh, and thank you to DHHS for their presentation today. It was a lot of information, and I can tell you that even the experts that work with these funding sources continue to have questions about how they all intersect. We have an internal work group that has been pulled together to help assist the JJ task force. And in that work group, we have judges, court administrators, and county partners from around the state to talk about a lot of these issues that are being brought up at the task force. And we had some robust discussion on funding and the finance structure that we have in Michigan. And I'm going to go through kind of our overarching themes of those discussions and then break it down by child care fund and the general fund and the other funding that we see, and then open it up to some of the task force members for questions or additional comments that might help make a finer point on some of these issues. So I think it's pretty clear that our courts rely significantly on funding assistance from the state through a variety of funding streams to help operate the juvenile justice system in Michigan. And the courts agree that the system should be one that's marked by transparency, accountability, equity, and one that is effective. We also need to balance those principles with not being overly burdensome to administer. And that is a key theme that we heard through really all of this is the burden of this funding structure. It is not easy to use. It's administratively burdensome. Funding and programming varies by county because of this type of funding structure. And so the concern is that best practices may be disincentivized because of the need for state funding and a lack of other funding to help support those best practices. Why that's such a big problem is we're going to see huge disparity across the state depending on what additional funding is available outside of the child care fund. So when talking about the child care fund, absolutely, it's the most significant source of funding for the courts. As you heard, it allows our local courts to get 50% reimbursement for some of the juvenile justice related expenses. I want to highlight that it is not for all of them. So the conversations that the task force is having on what we think are the priorities and what we're going to be discussing in the coming months as far as what recommendations are, we think it's important that everyone understands that currently the child care fund, that reimbursement, most likely doesn't cover all of the things that we're talking about. And Judge Allen touched on that, prevention, diversion, and other things that we think are best practices and we want to move towards, may not currently be reimbursed by that fund. There's also overwhelming consensus that this is incredibly administratively burdensome. There's complex rules that can be very restrictive. It does not promote the use of an informal processes like prevention, consent, and diversion. And it's a significant administrative time for the courts as far as submitting the paperwork, getting information back on what's covered and what's not covered. And the budget amendment process makes it hard for courts to be nimble. The program rules can also impact staffing and supervision levels of juveniles, which is a concern, and can present serious cash flow challenges for counties because it's reimbursement based. Although there's been feedback that those challenges have gotten better in recent years, so that's a positive. There's a lot of benefits of the child care fund. As I said, they cover significant costs of juvenile justice, the staff, programming, and services, and it's a stable funding source that allows our local courts to be forward-thinking and planning, but it also creates a huge void in a lot of the work that courts want to be doing. That transitions into the general fund dollars, which are also key to help our local courts fund juvenile justice. So our courts have to work closely with their board of commissions and work on that cost sharing with the child care fund, and also their own initiatives and activities that the child care fund or other funding streams don't cover. Why that matters is because you may have different financial ability in some counties or different relationships or priorities. And if either the funding doesn't exist or juvenile justice isn't a priority, that general funding that general fund money may not be available for some of the programming that those on the task force think we really need to be looking at. The general fund process is less burdensome, but still requires transparency and accountability. And courts are constantly working with their commissioners to educate on the importance and need for juvenile justice funding and the outcomes for youth. We heard about the basic grant. I'm not going to comment on that too much other than to highlight that this funding has remained stagnant for years. It's $15,000 a year. It's only available to our smaller counties with a population of less than 75,000 people. And it's really just not enough funding. If this is going to be a source of funding for smaller counties, we really need to look at increasing that amount. The county juvenile officer grants, those were originally implemented to help pay for juvenile officers within the county. Again, the problem there is that the funding has remained stagnant. It's helpful, but those funds really don't provide the level of financial support that they once did to meet the need of what those grants were intended for. The benefit of them is that they're easy to use and administer for the courts. And then we talked a little bit about federal funding, and really it's identifying what those opportunities are. I think for a lot of the feedback that we got is being able to identify what other federal funding is out there, and doing better as a state to maximize that federal funding, which may answer some of the last questions that were on that list. But overall, our conversation really resulted in the desire to, instead of saying, where do we currently get all of the funding for juvenile justice from now, and how do we want to change that? We want to start at the other end and say, what are the services? What's the treatment? What do we want to provide? And what do we want juvenile justice to look like? And then how do we fund that and make the adjustments from there? Because the concern is that if we are just looking at the model that we currently have, that we're going to see disparity across the state, depending on what resources and interest you see from different courts. So we really want that conversation and the questions that are being asked to almost be flipped and to say, what do we want our system to look like? And then how does the funding structure help support that? So that's an overview of the feedback that we've gotten. I know that there's a lot of people that are interested in working on this piece of it when the task force breaks into smaller work groups. But I would start the conversation by asking our judges or our local partners if they have any additional feedback, especially from the presentation today, and the kind of summary of where the courts and our local partners are at this point. I know Judge Allen is going to have something to say.
Let me just indicate that was a spectacular review of a lot of tortured conversation with judges and local people and the Michigan Association of Counties. That the relationship between managing a court at the local level, I'm the probate and juvenile court, it's very difficult. It really is, and you've done a great job of summarizing it. Child Care Fund is not nimble. And it is in the hands of people that don't always understand the needs under the juvenile justice parameters as far as rehabilitating kids. So I think we are on the right track as far as identifying problems. I would love for this group to be talking about, if you had a clean slate and you were imagining what needed to happen in Michigan, just pretend that we don't have the current structure that we do. what would it look like? That's the essence of really what we're talking about here, to me, with this task force.
Thank you, Judge Allen. And I think, from the conversations that our internal work group has had, we hear about all of the great things that are happening in our courts and our counties around the state. But it depends on a lot of different factors. And I guess, my takeaway from that is, should it depend on whether or not the court and the county have a good relationship and work well together? Should it depend on whether you have a judge that has really great ideas of how to reduce out-of-home placement without the funding to help get there, but just it takes hard work to do that? Shouldn't we have that available to every single youth in our system? And how do we get there? And I think, when we talk about the financing piece of it, it brings in all of the other conversations that we've had up until this point. I don't know if Tom, if you have anything to add from the court side.
Yeah, I would just add that both you and Judge Allen did fantastic, as always, presenting our needs and issues. I would follow up to say, when we think of key points and best practices that are happening maybe in Ohio or Washington or wherever they might be, there are also local courts doing it now with the current funding structure and able to incentivize their own local needs without support from the state. Judge Allen mentioned how much she's reduced residential placements for her community, and that comes at a significant benefit to not only the budgets of our county, but our kids and their families. And so I think when we look at key significant points, there are local jurisdictions across the state that are already using the funding available to them to do best practices. Just how much more could we do if it was different? And so I know that amongst us judges and court administrators, we've put some best practice lists together and matched it with our funding. And again, I just would encourage us to look at those as well. Maybe they're smaller jurisdictions in the state of Ohio, but they're accomplishing good things with budgets and kids and families.
Great, thank you, Tom.
This is Tammy. I have a, I guess, quick related question based on what Tom just said. I know with some of the parents that we represent who've had children through the juvenile system, they end up with, huge bills from the county. I've seen them upwards of, 60 grand when a child has been placed in a residential facility, and parents who are working at best minimum wage jobs. How big of a funding source really are the parents to seek reimbursement from? How common is that practice of the county seeking reimbursement for some of the county's costs? Or have we looked at that at all yet?
Cammie, that's a great question, and it's something that came up when we had a review of the defense system for juveniles in Michigan. And I know that work has been done in various counties to really address that. I can't tell you statewide how much is being charged to the juvenile or their family, and then what that collection rate is. I can tell you, that there have been counties that have looked at it and said, this doesn't make any sense. We're spending all of this money trying to recoup these costs and through the collections process, and the amount of money being spent on that isn't getting the return on that time. That's not to say that is everywhere. Again, I don't know what each and every county looks like. I can just tell you that I know that there have been some counties that have really dug into that and made a decision on whether or not it made sense to continue doing that.
And I'm gonna tentatively say that we will have some statewide data on fines and fees that we're going to be able to analyze and share. I don't know what level of detail we're going to be able to get, but that can answer at least some of that question in terms of what that actually does look like statewide and also on a county by county basis. But I think it's also an important question in the context that Justice Clement and others are raising, which is what would a funding structure and system look like that doesn't place any of that funding burden on youth and families to support programs and services.
Can I just add something at this point? In Midland County, I actually have tried, no reimbursement, literal reimbursement, in other words, dollar for dollar. And then I am now at a ability to pay. And it can be anywhere from community service to a literal dollar for dollar reimbursement, depending on the financial situation of the family. What I found with a universal, nothing, you don't need to pay anything. We're going to take care of your kid, and we're going to take care of your youth, and there's not going to be a dollar amount sent to you, is that I didn't have the level of accountability from parents that I needed to. And I am always willing to talk about, waiver. We do hefty waivers right at the front end, with, dependent on the economic status of the family. So I think you will find that each county has a different system on that, Cammie, and it's a great question. I did start out totally different than where I'm at right now.
Commissioner Webster.
Just speaking as someone from a smaller county and in conversations that I have had locally, it is kind of a double whammy for smaller counties, because we don't have a lot of options for programs that are not an out-of-home placement. In a lot of cases, it is even out of county or out of state that we find even an out-of-home placement, and we just don't have a lot of, I've been told by our local court staff that they often place kids who shouldn't be in out-of-home placement there because they don't have any sort of middle options. But then our wages in Shiawassee County, more than 50% of our jobs, at least a couple of years ago, and it's probably up a little bit now, more than 50% pay $12 an hour or less. So we have very low socioeconomics. So you have a higher percentage of kids being put in out-of-home placement, and a higher percentage of people in a low socioeconomic status. And it really does create a burden on families. It's kind of a double whammy, being a sort of under-resourced community.
Great. Any thoughts from the rest of the task force about what we've talked about up until this point, or looking at those key questions? Are we asking the right questions? Are we missing any questions? Do we want to reframe any of them? Jason?
Thanks, Judge, and sorry, for some reason my camera's not working. But a great overview. I'm glad that the conversation about fines and fees came up. I've also heard from a lot of families who feel like not only is it a burden, but also a barrier in engaging with court staff in certain situations. I really appreciated what Judge Allen said about the clean slate and dreaming big. I do hope that we do that. And in addition to thinking about additional or changes to funding structures for juvenile courts and court structure, I'd like to dream about what diversion and prevention would look like, even supported higher upstream. Like we talked about when we did the diversion overview, the Juvenile Diversion Act does allow for law enforcement agencies to provide diversion programs as well. And in other states, you do see much more of that, where schools and police departments handle diversion before cases even get to the court. I used to run one in suburban Chicago many years ago. So just hope that in our dreaming big, we also incorporate not everything that comes with juvenile justice reform is a court fix. I think that there are other entities that can play a role, much larger role than they currently do.
Great, thank you, Jason. Anyone else with thoughts, comments, questions?
I have just a comment, and I'm sure you're well aware Earlier this year, there was the report that was released in regards to some, the national trends, Justice Clement, we talked about it. But after that, there were a package of bills that were dropped and filed in regards to juvenile fines and fees and stuff like that. Are you aware of that package, that statute's opened right now, at least for this term?
Yes.
Okay, because right now it's not going anywhere. Even though it's a bipartisan package, it's just kind of sitting there because this other piece is happening with the whole juvenile justice. So not letting the, lobbyists run that package, but just kind of stall. I asked the chair to stall that, even hearing anything, because I feel like we don't have all the information yet, and some of the information that'll come out of here might go into that, but it might be an easy gateway because that statute is opened once recommendations come out to actually maybe get something done before the end of this legislative term.
Great. Thank you, Representative Leitner. And I know that you have that in a lot of different areas. A lot of things that we're talking about, you've at least put in legislation to kind of be a placeholder for those discussions to continue. So it's very helpful.
Yeah, and on the money side, it is helpful too. If I know, what's going on and talking to the appropriations chair, because as you know, I'm the appropriations subcommittee chair for judiciary. So that, all the money stuff that goes through the judicial cycle, our system, will come through our committee, my committee, at least for the next year.
Josh, I think maybe the only piece that I can't wrap up without mentioning, and you've mentioned it several times, is that data is a huge piece of this. And without some of the data points that will help us understand how much money is being spent and where and on what, it is hard to have this discussion. I hope that doesn't prevent us from moving forward with doing what Judge Allen has suggested of, a clean slate of what would we want our funding structure to look like if we could start from scratch, and with a thought of, this is what we want the juvenile justice system to be able to provide in Michigan. So I know that the data is a huge piece of that, and that you guys have had your hands full trying to collect that and use that in a way that helps inform the task force to make decisions on some of these issues.
So any last kind of big picture thoughts? Again, I know Friday morning conversation about financing, but as you can hopefully hear from everything Justice Clement and from other folks have said, this really is gets at the crux of what is the juvenile justice system in Michigan, and the current financing structure is complex, and the devil will be in the details about not just reimagining the vision, what that looks like in practice. I think the good news is everyone's at least a little unhappy with the current financing structure, whether you're coming at it from the local level or the state level or different entities. So at least in our conversations, we feel like there is really good momentum to take this on, and to really think and really appreciate what Judge Allen and Justice Clement said about not necessarily starting from the current financial structure and saying, how do we tweak that? Although again, the devil's in the details, but saying, what do we think juvenile justice should look like across the state at least a baseline foundational level in terms of policies and practices? And does the current funding structure support that vision? And if it doesn't, what would a different funding structure that gets us closer to a research-based, evidence-based, data-driven system look like across the state? Is really a fundamental question. And so to that end, key next step coming out of this conversation is the formation of a working group to start to tackle that big picture question around system financing, which obviously bleeds into these other areas. We've been working behind the scenes to identify kind of a representative set of state, local, association, and other kinds of folks to participate in that working group. It's already a large group. As you can imagine, there's a lot of folks interested in this, but I do want to say that if based on this conversation or based on your work, you're be really passionate about participating in that working group, please reach out to me directly. We're hoping to start meetings after the new year and really go to the summer. As noted, a number of working groups will be formed. There'll be one about data after the January meeting, and then these other ones, diversion, out of home placement, court processes, starting in February as well. But we know the work of this financing group is going to take a long time. So the expectation is to meet for months, probably meet bi-weekly, and engage in the discussions needed so that that group can present a full set of recommendations back to this task force. So if you're interested in and willing to commit that kind of time, please get in touch with me directly, because I'll be trying to coordinate that group and set out a first meeting in January. Judge Allen, you're muted. Looks like no. Okay. There's a question in the chat just about state and county roles around this funding structure. And so I think that will be part of the conversation for the finance group, but also for this task force to consider overall, not just the vision and not just the mechanics of the funding structure, but kind of where the money sits and how it gets allocated. So for folks to think about both the substance and the structure and roles and responsibilities, it's obviously a lot to take on, but all part of the discussions. Any final comments or questions? Justice Clement, anything else you want to add?
No, just thank you to everyone and to our work group members that are not officially part of this task force. They've we meet every other week and spend a lot of time talking about all this and the effort to help the overall task force with all of their work. So I appreciate all of the input that I got so that I could share all of that with you.
And thank you, Justice Clement, for sharing that and coordinating that feedback and the discussion. Thank you to Teddy for going through the finance presentation. Thank you to all of you for sticking with it over 2-hour meeting on system financing. We will be sending out the materials shortly after the meeting. As I mentioned, we'll be coordinating pretty quickly a first working group meeting. So please get in touch with me. If not today, then sometime early next week, if possible, if you would like to participate in the working group. We will certainly, it won't be 6 months before you hear from that working group. We will be sharing updates and some of the discussion that's coming out of it at ongoing task force meetings. Otherwise, we have a next meeting set for January, and I hope everyone has a safe and happy holidays, a wonderful new year, and we'll be excited to start really moving to the next phase of this work after the new year. Thank you all for your continued time and commitment.
Thank you.